for being here. I think we have a great presentation on the docket for you all this evening. And so I will just do a very brief introduction, and then Dr. Lydell, if you want to just take it over, that would be great. So on with us tonight, we have Dr. Jessica Lydell, and she is an assistant professor in the School of Social Work at the University of Montana. So we're very excited to have her here, and Jessica, feel free to just take it over.
Great. Well, thanks, Mandy. Yeah, I'm really excited to be here too. So I'm in the School of Social Work, but I'm also affiliate faculty in the School of Public Health and have both a social work and public health background. And so I am all about sort of the ways that we can work in interdisciplinary ways and have collaborations with different disciplines. So that's why I really love the AHEC program, because it just seems to kind of really much kind of embody that. So I give this lecture that I'll be doing today on reproductive justice to a lot of my social work students. And so I'm also really excited to kind of get your unique perspectives, because I'm sure that you'll have insights that are different than some of the things they have. So I will mostly be kind of going over a PowerPoint, but I have a lot of points where I'm going to pause and ask for feedback. And so I know that we're kind of a big group, but it would be great if just people can kind of jump in as they have thoughts and particularly from your various kind of areas where you're working and things like that. I'd really love to hear. So yeah, I'll go ahead and start screen sharing. All right, are folks seeing the PowerPoint? Okay, let me get this out of the way. All right. So as kind of I noted, I'll be talking about reproductive justice today. So some of the theory behind reproductive justice, its history and kind of the context of why it's needed, and some of the ways that I use it in my own research and potential implications for practice for all of you. So first of all, I always like to see how many people know what reproductive justice is, or have heard of it before at least. Okay, see there's maybe like one raised hand. Okay, two, okay. Or anyone want to kind of hazard a definition? I know it's kind of the scarier part, but what it kind of means to you. And you can just maybe say it.
Having rights around whether you reproduce or not.
Great. Other things people want to add to that? So that's one of the really key components, the right to kind of your reproduction. There's a third component. I wonder if anyone can guess it. I think it's particularly relevant when we think about kind of the smoke in the air in Montana or some of the other things for children.
Is it like the right to a healthy pregnancy of some kind?
That's a great, I love that you mentioned that. It's not, but that is something that I'll talk about later. So I'm really glad that you're thinking there. Yeah, so it's actually, so the three are, so kind of that people mentioned. So the first, the right to have children, right? So this means that particularly for groups who've been marginalized historically, they've actually had their ability to have children taken away, either through the foster care system or through forced sterilization, right? The right to not have children, which I think some of you kind of spoke to. And then that third one, which you were just kind of mentioning, so the right to parent children in safe and healthy communities without fear of violence. And then now we think about that also in terms of kind of environmental safety and all the things that we need to have children. So I really love this definition, because it goes beyond what we just think of sometimes with reproductive health, where it's just kind of one thing. And this is kind of a more holistic approach. So we'll kind of go into kind of more about this in a second, but just as sort of, these are the kind of the considered the three pillars of reproductive justice, right? So the right to have children, not have children, and the right to parent your children. So we talked a little bit about this already, and that reproductive justice goes a bit beyond reproductive rights, but what else do you think already makes it be a bit different? And I'm sure some of you are doing work maybe with reproductive health agencies, so I'd love to kind of hear your thoughts about what makes this sound different right away.
The justice piece.
Great. I like that you mentioned that. Yeah. What does the justice piece give us that when we're just thinking about rights maybe is missing?
Well, there's when reproductive justice, I mean, there's a fear now of criminal activity and stuff for reproductive rights.
Yeah, so I really like that you're connecting justice is more, it's almost related to more like our rights as a human right, and reproductive rights is more sort of just limited to that particular right, is sort of kind of what I'm hearing a little bit. Yeah. So here's a little bit of when we think about reproductive rights and why they might be a bit limited. Again, reproductive rights are good. That's not what this framework is saying, but it's kind of pointing out some of the limitations if we only use a reproductive rights approach. So this can be illustrated, right, in Roe v. Wade, right, which really focused on individualism. And so it really grounded abortion in a right to privacy. Which has now ended up being undermined, obviously, right? In contrast to one rooted in human rights and equality and equity, right? And so Ruth Bader Ginsburg actually, obviously she supported Roe v. Wade, but she was worried of this, that by limiting ourselves to a focus on privacy, that it was ultimately going to allow Roe to fall, which it did. It also, reproductive rights movement historically has tended to really focus on issues that are mostly important to white women, wealthy women, and women who have access to sort of formal education, women who are identify, or cis women that have these sort of forms of identity, which is fundamentally not representative of all people, right? And certainly not of all women. And then this last point, which I said earlier, right, but this privacy framework has ultimately not been sufficient to protect reproductive justice and autonomy. So the reproductive justice lens is broader than either reproductive health or reproductive rights framework, and it really puts health in that justice context, which one of the students mentioned earlier, right? So the concept of reproductive justice itself was also developed by women of color. So I think it's really important to acknowledge that it really came out of an activist group of women who were really responding to some of the ways that reproductive health was being talked about at different population conferences that were held around the world. So particularly this one that was held in Cairo. So they really noted that when people in the reproductive health world were talking about reproduction, it was always about population control. How do we limit the number of people, the number of children people are having? And it really wasn't about justice or empowering people to have autonomy. So they really came up with this concept as a way to kind of counter that. And then other women of color organizations, most famously Sister Song, which if you don't follow them, I really recommend it, kind of further refined the concept and really brought it into activist circles in the United States. So again, it really moves away from kind of the previous narrow focus on really basically just contraception and broadens it. So what kind of also further distinguishes it is that reproductive justice really acknowledges that everybody's ability to control your reproductive autonomy is shaped by multiple things in the world that go beyond just legal access, right? So particularly, this applied in the case of Roe v. Wade, where even though there was legal access to abortion federally, it didn't mean that people could actually access it because of poverty, because of healthcare deserts, because of a variety of factors, right? It also really notes that people are not treated equally by healthcare systems, right? And so it noted that if you are a particular race, the providers that you work with are going to maybe treat you differently, or the social worker might treat you differently, right? That your ability to navigate systems with insurance, right? Or knowing the language, right? Or being able to enter the office, it really kind of broadened our focus to look beyond just legal access and look at all these other ways that even if you have legal access, that doesn't mean you have true access, right? It's also different in that it doesn't just use legal avenues to try to get reproductive rights and justice. It looks at legal stuff too, but also community activism and organizing, right? Voting and mutual aid, right? So finding ways that people and communities can really help themselves achieve these goals, right? It also doesn't just try to address the immediate need a person has when they come into a provider's office, but really look at what is causing, what is at the root of that reproductive oppression, right? As part of that, then fundamentally it calls for systems change, right? So that can be hard, right, to change systems, and so they will still provide services that people need in the short term, right? But it wants to make sure that we don't lose sight that ultimately, to have true justice, we need to be able to change systems. Are folks here familiar with the concept of intersectionality? And if anyone is, maybe they can shout out kind of what they think the definition is or what they think of.
So when like several marginalized groups or different groups intersect at a point. So like for an example is you could be an African-American female struggling with poverty.
Yeah, exactly. So it looks at how we are not unidimensional people in the world, right? So that my identity as a woman in some ways may put me at disadvantage in certain areas, but I have white privilege and I have education privilege and I have language, I have other forms of privilege, right? So it really encourages us to look at kind of the different ways that someone's identity makes things either easier or harder to move in the world. And it's really different because before, a lot of thinking about oppression was either kind of you were oppressed or you weren't, right? And it didn't look at more of this nuance, right? And how identity is complex. So that's something that reproductive justice really centers, right? That it's not just enough to have women who are, or people with uteruses is sort of now the language we're moving towards. Their voices should be centered, but that's not sufficient, right? We also need to make sure that we're centering people who have unique experiences beyond that. So here's sort of just kind of a good way of thinking about how these sort of are similar and different from each other, right? So reproductive health is more generally about service delivery, right? And so it's really looking at how we can improve access, right, to services. Reproductive rights is more about advocacy and really focusing on how we have a lack of legal protection and using legal means to protect women's right to reproductive health care. Reproductive justice, in contrast, tends to be a bit more in movement building and looks at how reproductive issues are connected to social justice, right? And so they're similar, and again, they're not at odds with each other. And actually, a lot of reproductive justice researchers have come out saying that, like, don't say that you're not a reproductive rights person, like that's important, right? But that's not necessarily sufficient, right? There's also concerns now that reproductive justice is, at least in the areas that I work in, has become sort of like trendy. And so every organization that does reproductive healthcare kind of slaps on its website that they do reproductive justice, and that's not really appropriate, right? If you just do really good reproductive health delivery, that's good, do that, right? And incorporate reproductive justice when you can. But if you're not truly doing movement building, if you're not really trying to do systems change, it's not as appropriate to use that framework. Questions with any of that? I know this is like a lot of information at once. Okay, I'll keep going, but please really do interrupt me because I might use terms or things that that I know because this is what I live and breathe every day. But if not, I just want to make sure I don't miss anything. So reproductive justice in particular is a response to that women of color and low-income women, and then also younger women. I think it's important to acknowledge too that not even just considering teen parents, but even just people who are, in their early 20s, sometimes face resistance from providers or from society if they choose to have children, right? And then similarly, they can also simultaneously have trouble accessing contraception or abortion, right? So kind of from both sides, they're uniquely impacted in a way that restricts their access. So the Hyde Amendment is an example of that, where it banned federal funds being used to pay for abortion, right? So even though abortion was legal, only people who had the financial means to pay for it could get it, right? And women of color really pointed out the hypocrisy in some of the feminists who were reproductive rights organizers, because they sort of put their hands up and said, well, this doesn't really impact us, and didn't really do much about it, right? Even though this had a really chilling effect on a lot of people being able to access care, right? Reproductive justice really also centers how disadvantaged groups, generally policies for them are meant to kind of restrict and control their reproduction, right? Whereas most reproductive policies for white women generally tend to be ways to increase their reproductive autonomy, right? So any laws that are passed are in the one direction if you have privilege, and any laws related to reproductive health in the other are about restriction, if that makes sense. So another thing that's really interesting is that in reproductive justice, the goal is not actually that the government doesn't interfere in reproductive decision-making. I should clarify, they don't interfere in the decision-making piece, but they actively interfere in making sure people have full access, right? So I think that's sort of different too, in some ways, when we think about reproductive rights. It's like, keep the government out of my womb, right? And it's like, in some ways that's accurate, but again, for women of color, in particular, their experience is more that they haven't had access, right? And there's been these kind of things that are barriers to them being able to have their reproductive autonomy, right? And so that actually what we need is increased social services, right? Increased healthcare access, right? Social justice programs that actually have more, lead to more social equality, if that makes sense. We already mentioned this a bit before, so I won't belabor it too much, right? But reproductive justice, again, really centers that multiple forms of oppression and discrimination are present, right? So that even if you are able to get someone access to prenatal care, right? So a related part of reproductive justice is birth justice. And so I do a lot of work in that sphere, which I'll talk about later. But part of that is, making sure that people can get to their appointments, right? That is covered by insurance, right? Expanding coverage with Medicaid so that it doesn't get cut off, 60 days after you give birth, right? But then reproductive justice doesn't just stop there. It says, okay, but then what also happens when your child is born, right? And you have to go back to work and there's no childcare facility to take them to, right? So it really takes a more holistic approach. Questions about reproductive justice? We're still going to talk about it, but kind of more specifically in kind of the framework. Is it really like gelling with anyone? Is anyone like, I love this framework, this makes sense? Or are people still kind of figuring it out? I haven't converted anyone yet to be a reproductive justice fan.
No, I think it's super interesting. I just thought, because you brought up childcare, how the cost of childcare alone, in a way, is restrictive of reproductive rights.
Definitely. Yeah, there's so many things that when you start to kind of unpack everything that goes into reproductive justice, it kind of just, the thread just never stops, right? Because it's childcare. It's if they're not only like access to it, but is it affordable, right? So not only that it needs to be there, but you can afford to do it, right? That you have sufficient parental leave so that you can still spend the time at home. That if you want to breastfeed, that there are workplace supports so that you can do that, right? So it just kind of, it never ends, really, all the different ways that we sort of subtly and not so subtly restrict who can have children, right? So I was really lucky that when I have a 2.5-year-old son, and I am often able to work at home, right? So my ability to care for him during COVID, when I had no childcare, was easier than it would be for someone who was just sort of stranded when daycares were closed, right? And they had to go back to work, right? So again, looking at all these ways that these things intersect with people. Anyone else kind of starting to become a fan, or at least kind of thinking about it?
I was curious on, since like the right to parent is like a very expansive goal, especially like saying like having a safe community, like for children, you're pretty much guaranteeing a safe community for all people at that point, which I think is great. But I'm wondering kind of like in that framework, where would be like the low hanging fruit that like reproductive justice would be targeting?
Yeah, excellent question. And I love that you're connecting that, how like, basically, if we do things that are good for parents and children, like it actually is good for all of us, right? So again, parks are nice for kids, but like everyone likes parks, right? So just kind of all these different things. I mean, I think that another important thing about this framework is that it really allows communities to define for themselves what they want. So I guess I'm a bit hesitant to say like across the board what is needed, but I will say, for example, in Louisiana, I did a lot of work with an indigenous tribe there. And for them, what they really wanted, what they told that they needed was supports for new parents as far as social and emotional supports, right? So they really wanted community spaces where new parents could get together and talk about what they needed. They also specifically said they just wanted doctors to have a little bit of training in how to be culturally competent with Indigenous parents, right? So those are just examples of like what came up in that specific community. It will vary everywhere. However, I will say that in Montana, just based on my work now, I think it's really that access and that distance piece. So I think if we can find ways that we increase access, whatever that looks like, right? So I think some people like telemedicine, some people don't, right? So again, I think it'll depend on the issue, but I think that the biggest thing in Montana is just the long distances people have to get care. And I think that would be, I guess, that's not a low hanging fruit, I guess that's a high hanging fruit, right? But I think that that's something that would be really important. A good question. I'd love to see if other people think of kind of any low hanging fruit or things that they think would be good ways to sort of address reproductive justice.
Hi, I'm in the nursing program and at MSU here in Billings, and we just learned about the nurse family partnership in Montana, and that seems like a really kind of, or at least it could be a pretty robust way of addressing a lot of those young moms or parents. I was curious how you feel like, so there's a ballot measure on the ballot right now, the like Born to Live.
LR 131. Mm-hmm.
Yep. And it seems like adjacent to this topic, but also related in the sense of kind of cost. Like I was like, if a child is born and they have all of these medical problems and interventions that need to take place, it just seems like it would be a huge burden to potentially a mom who didn't necessarily want the baby. So I was just curious what your thoughts were on that ballot measure and how it kind of plays into this.
Definitely. Yeah. And this will be a very brief answer because this is a very complex topic. And I will also state now that I can stick around after for a little bit if folks want to have kind of deeper conversations. But yeah, fundamentally, I think it's a very cruel initiative, and it's really depriving parents of the ability to hold their child, right? Sorry, I'm going to get emotional because I do think it's an emotional issue, right? So that instead of being able to hold their child who is not viable, right? The child's going to be taken away and have all these really unnecessary procedures, unnecessary because ultimately the child will still die, right? Anyway, so it's also laying the groundwork for further undermining legal access in Montana. So we are lucky in Montana that we have a very robust access currently to abortion access. However, I think that this, even though it's not really about abortion, these are children that are wanted, right? This is not an abortion, right? But it is being framed that way, and so that it can lay the groundwork for later chipping away at abortion care. So yeah, good question. All right, well, kind of related, we're going to talk about reproductive oppression. I know I'm being very cheery today, but I know that I also want you to leave feeling optimistic, right? So this framework gives you tools, even though it is a framework that is coming out of kind of these hard stories, right? So does anyone have an example of what they think reproductive oppression is? I guarantee you all can think of at least one.
Is it like when, like younger women, for example, are not allowed to have their tubes tied, for example?
Yeah, that's a great example. And it's interesting you mentioned that because one of my interviewees when I was in Louisiana actually knew that she really didn't want to become a parent and had that happen where they really didn't respect her as a person, even though she was 25, she wasn't like, 15 or something. But yeah, so that's a good example. I'll give you a definition and we'll go into some more examples too. So reproductive oppression is really the different ways that we control and or exploit, right? People's bodies, their sexuality and kind of their labor related to reproduction, right? And so, and the idea is that by doing that to an individual, it ends up being a way that you can control an entire community, right? And it's very complex in that it also relates to these other factors that are central in reproductive justice too, right? About whose reproduction we value, right? So you'll have policies that make it really hard, often historically less so now, but still somewhat true now, if you are a white person, right? Particularly if you have class privilege, right? That doctors will sort of discourage you from like getting your tubes tied, right? Or something. Whereas if you are a person who doesn't have that privilege, doctors will sort of actively encourage you to get your tubes tied after you give birth or these other types of things, right? So some examples, sorry, I got ahead of myself, right, before giving the definition. So some of those, these are kind of really, again, hard examples, but they're important for us to think about, right? So slavery is kind of one of the quintessential examples, right, of how we really had reproductive oppression on people in the United States and has had long-lasting legacy, right, on healthcare outcomes, right? And understandably made people, for you all in your professions, I'm sure you know that sometimes people are hesitant about engaging with healthcare systems because of this long history, right? There's many, many examples of sterilization abuses of Indigenous women, African American, Puerto Rican, Latinx women, just across the board, right? Here in Montana, particularly for our Indigenous groups, forced removal of children, whether through boarding schools more historically or currently in the foster care system, is an example of reproductive oppression, right? Treating certain people as disposable when it comes to healthcare. So I don't know how many of you are aware that the contraceptive pill, which again has done a lot for us, right? But was created through human experimentation on Puerto Rican women who did not know that that was what was happening, right? And some of them had some pretty dramatic side effects, right? Because they were figuring out like what dosage to use, right? And they were using dosages that are much, much, much higher than we have now, right? Also, I think a lot of people aren't aware of some of the immigration laws that are in our history that are really fundamentally trying to control reproduction, right? So not letting women or families come in, but letting the male laborers come in, right? And this idea being that if the families aren't there, if their partners aren't there, then they won't stay, right? So again, very much trying to kind of control people in that way. There's welfare reform laws that try to really limit the number of children people can have. These kind of get into legal jeopardy sometimes, but still kind of get resurfaced in various ways. There, until very, very recently, were still programs that offered reduced jail time if you were willing to undergo sterilization. Most of these now have been shot down for women, but they are still allowed in some states for men, right? So that men can receive reduced prison sentences if they're willing to get sterilized. And then also the types of contraception that insurance covers, right? So Medicaid, which again, usually is going to be used by people who have less privilege in various ways, often will kind of over encourage the use of long acting contraceptives, right? That require a doctor to be removed, right? And so there's kind of that coercion, right? And kind of trying to limit people's reproduction and not wanting to give them something like a pill where you kind of control when you get to stop it. Questions with any of these or kind of other examples that might have come to your mind, kind of hearing me talk about this?
I immediately, once you defined reproductive oppression, thought of The Handmaid's Tale. It's a show I got into, and yeah, of that.
Yes, that is definitely a classic example of it for sure. Yeah. Other examples people can think of? All right, well, let me know if you
I
think of
was also
something.
thinking of like choosing like how you give birth or like what you want to do with your birth as well. Like,
Yeah.
oppression that way, like just the control of like what a woman does with their body, kind of.
Yeah. Yeah. And I think often now we think of that in terms of sort of the birth justice movement, but you're right. I think that that can also be thought of as a form of reproductive oppression. So I like that you mentioned that. It's something that's very near and dear to my own research is all about really empowering people to have the birth experience that they want to have. Yeah. All right. So thinking kind of more about some examples, so reproductive justice for Indigenous women. So Indian Health Services is mandated to provide healthcare per numerous treaty agreements, however, has really failed in effectively providing healthcare. And this is for many reasons, and it doesn't all just fall on IHS. It's a complex system, right? And it's certainly not pathologizing individual providers in that system, right? But it has resulted in really dramatic health disparities, right? And particularly, well, throughout the country, really. So, but in Montana, this is certainly reflected, right? Life expectancies that are lower, right, more likely to have eclampsia, preterm birth, right, other types of things that really lead to poor birth outcomes, right? And this is really very much related to kind of systemic oppression, right? So again, ways that people are being systematically deprived access to resources. And I think particularly for what I'm interested in is discrimination in the delivery of health services, right? So there's a robust body of literature showing that if the identity of your provider doesn't match your identity, that they are less likely to spend the same amount of time talking with you. And again, I think some of this is subtle. This is not saying that individual providers are purposely doing it. Sometimes they might be, but I think they often aren't, right? But that discordance between patient and provider can be a barrier, right? And currently, I think we're trying to work on this, right? There are relatively few Indigenous providers, right? Sexual violence is also an important issue that is directly related to reproductive justice, right? Sterilization, which I know I mentioned earlier, but I really want to highlight that on some reservations of reproductive age women, up to 80% of those women were sterilized, right? And then we see extremely disproportionate uses of long-acting contraceptives for Indigenous women, right? I already mentioned boarding schools. And I say all this with the context that this is not consistent with again, no Indigenous group is going to be the same as any other group, right? But generally, many Indigenous groups really valued and empowered women to control their reproductive autonomy, right? So all of this, what's happening contemporarily, is in contrast to this long, rich history where people did have more reproductive justice historically. Some other reproductive justice issues in Montana. So we've already talked a bit about abortion right here. So even though we do have it protected in our constitution here, right, 55% of people, however, live in a county that doesn't have an abortion clinic, right? So that this is kind of a form of a barrier to care, right? We also had the lowest rate of WIC coverage in the country, which I was kind of shocked when I moved here because I'm coming from the South, which also has extremely low rates, right? We have maternal health care and childcare deserts. So unfortunately, I don't think I'm going to get to talk about all the research I do today because there's just so much I want to share with you. But I do a lot of work particularly related to maternal health care deserts, right? And so meaning that there's a lot of places in our state where you would have to drive, and I'm sure a lot of you know this, you're in this area, have to drive hours to get care, right? And if you have a complicated pregnancy, right, you usually end up having to get a scheduled cesarean and spend a substantial amount of time away from your community to make sure that you can get adequate care, right? Sex education in the state is not really adequately protected, right? So even though there is sex education allowed, it's not very holistic, right? And then state hate crimes also are not really explicit on protecting people on sexual orientation and gender identity. And this is an extremely important area of reproductive justice. So some more kind of into this, right? So when we're thinking about maternal and child health outcomes, Montana has the sixth highest maternal mortality ratio, 14th highest preterm birth rates, and only 15.3% of people living in a place, that 15.3% of people don't receive adequate prenatal care, which is really, really high for the country. And this is particularly obviously worse in rural areas, right? And we know that much of Montana is rural, right? So it essentially means that unless you're really located in Missoula, Bozeman, Billings, right, in these really areas that have a lot of access, you almost by default don't have access, right? I'd love to hear if you kind of can think of other kind of maternal and child reproductive justice issues you've seen in your own work here in Montana.
So I did my graduate work in addiction counseling. And I think one of the biggest things that I've seen is the increase of women who are pregnant, who go in for deliveries and are going through withdrawals themselves.
Yeah.
and they didn't get any prenatal care due to the stigma behind it.
Yep.
So I think that's a huge issue in our society.
Yeah, I love that you brought that up because that's actually some of the work I do is working on developing recovery doulas. I'll talk a bit about doulas in a minute, but basically finding people who can support people when they're pregnant and when they're postpartum and when they're in labor who are peer support specialists. So they're specifically have that training and that experience to help people in recovery, right? And so we're really trying to find ways that make it so that people do go in for prenatal care, because that's exactly what the evidence shows is that people don't because they're worried about the stigma. They will sometimes have unnecessary pain during childbirth because they're worried about relapse. And so there's the need for education and support for ways that you can have pain management that won't necessarily cause relapse if they're in recovery and not actively using, and just general education with providers about how to support those people. So I love that you brought that example up because it's some of the work I'm doing. Other examples?
That makes me really happy, by the way.
Yeah,
I'd
feel
love
free
to
to
talk to you more about it.
yeah, reach out to me later because I'd love to connect you to that program. So yeah.
Perfect.
I think that goes along the same lines really of, just we talk about child removal and for people who use drugs and, we punish them rather than help them.
Yeah.
And I haven't read the guidelines, but it's my understanding that ASAM just came out with new guidelines about child removal.
Yeah, and I'm not familiar either, but I do know that there's a growing body of evidence that really it is better for children, again, barring certain types of neglect, right, to try to keep the families together, right? So I'm hoping that there will be more policy movement in that area. Good examples. Anyone else? All right, I'm going to keep moving ahead. I have so much to cover and I already know I'm going to have to cut out half of it, but that's okay. So I'm not going to talk about this project because I won't have time, but just to give you a brief overview, and again, you're happy, please feel free to reach out to me after. I love talking about this stuff, but I am working on a project where I am trying to use GIS, so that is a spatial approach to data, right, to map basically access here in Montana, right? And so we're looking at access to like everything, right? So lactation consultants, pharmacies, how many parks do you have in your community, right? Just everything that relates to reproductive justice, right? And then we're doing interviews with people to sort of flesh out what's missing in those stories, right? So maps are great. I'll go ahead and show you one of the maps we have. So here's a map that shows, where there's hospitals, right? And then also tells us, we have data, looks like it's a little bit cut off, that tells where people are giving birth, right? So we know that there are, and this was just for 1 year, so again, I'm sure it might look different this year, right? Certain counties that had no registered births, right? And then there are counties where more people than live in that county are giving birth, right? And so kind of this idea that people are traveling to give birth, which is not surprising, right? But that doesn't tell the whole story, right? Because someone might stay in their county because they don't have transportation, or they might stay in their county because they're okay that they have a facility with less access, right? So I'm going to be doing qualitative interviews with people to find out what's the background story to this map, right? And then we're creating something called story maps, which is going to be basically where we integrate the two. So I'm really excited for that. So this is just one thing we're looking at, which is basically looking at kind of OB care and where it's where there's high OB care. Again, people are giving birth places, but where there's really strong access, right? But we're going to do the same type of analysis for, again, about 100 different indicators, right? So I'm really excited for this project. If people are interested, again, reach out later. So then some of the other work that I'm doing is related to doulas, right? And so I'm interested a lot in maternal mental health disparities in Montana, right? And so some of you may be familiar, but when we think about maternal mental health disparities, we're often talking about perinatal mood and anxiety disorders, right? And they're actually the most common complication of childbirth, which people are often really surprised about, right? They're incredibly common. And they're really impactful. It's not just like you don't feel great, right? I mean, they have really intense emotional, physical, and importantly, for some folks, like the economic impacts, right? Because people really have to often not go back to work as soon or anything like that to take care of it, right? Because of Montana's kind of rural state and large indigenous population and kind of all these various that I mentioned earlier, all the negative maternal child health outcomes we have here, that also exacerbates mental health disparities, right? So we know that, for example, if someone has a traumatic birth, right, that they are more likely to then end up having perinatal mood and anxiety disorders, right? So if you are living in a county where there isn't sufficient medical care to make sure that you have a birth that is empowering, that isn't traumatic, right? You are more likely to then have these disparity, PMADs, right? And as many of you know, and I know there's a bunch of social workers on the call, right? That we have a dramatic shortage in mental health providers, and even more so in people who are really specialized in treating PMADs, right? There's only a handful of people that I know that really are focused in this area, right? So doulas is something that I am doing. I'm applying for grants left and right, trying to get this work funded, right? Really trying to look at how doulas, so I am also trained as a doula myself, right? Just sort of a background. So doulas are non-medically trained childbirth companions, and they've been really proposed as a way to support pregnant people, particularly in the postpartum time period, right? So doulas provide physical support, and so that could be things like just like helping give a massage or physically holding you, right, when you're in labor, right? But also information and emotional support and social support too, right? So those are really important things that a doula does that is not in contrast. It does not replace a midwife or a doctor at all, right? It is just a supplemental resource for someone. And what also makes it really valuable, and again, there's lots of research showing this, is that it's continuous, right? So there's a lot of work showing that it's not so much, I mean, it's great that sometimes a nurse can do this, but often nurses can't because, you know, your shift changes or you have 20 clients, you know, there's a lot of pressures put on healthcare providers in a facility, right? And the doula, however, can just be there for you pretty much the whole time. And they're not your partner, right? So they're not having their own kind of emotions that they're going through or a family member, right? So they're kind of a unbiased person who can be there for you, right? So doulas have been used in a lot of settings. There's work currently being done to get them reimbursed by Medicaid, right? So they're currently not, which is why they currently are really something that only people with a certain amount of privilege can use. But we're trying to work on, and many states actually have done this. Montana has not yet, allowing Medicaid to reimburse doulas. So I am also particularly interested in, so I know I already mentioned my work on doulas and substance use and recovery, right? So we're doing work on that already in Montana. But I am trying to start projects where we're looking at doulas who are specifically trained to provide PMAD support, right? So they'll provide the same type of care that a regular doula would, but they'll have some extra training specifically in trying to help people who are navigating PMADs, right? So I'm really excited for that. Again, I won't go into all of kind of the research details unless you're a real research nerd, and again, reach out to me later, but I'm really excited about that. So I wanted to make sure that I had time to talk to you today about environmental reproductive justice, because this is another area that I feel really strongly about. So guesses on what this is defined as, or how you might potentially hazard a definition of what environmental reproductive justice is. You know what reproductive justice is, so I'm sure you can hazard a guess.
Would it be a clean environment for both, like an environment free of like environmental toxins or contaminants during pregnancy and like during parenting?
Yeah, that's basically it, right? That's great. So it's combining environmental justice, which is really looking at kind of the social justice piece, right, to environmental laws, regulations, and policies, right? So really making sure that the environment is clean, right? And that importantly, people have kind of agency and control, right, over their own environment, right? And then combining that with reproductive justice, right? So it's really looking at how health kind of broadly is related to environmental disparities. And as I think, as you said, environmental injustice can lead to reproductive injustice, right? So I have not yet started doing a lot of work on this in Montana, but certainly in Louisiana, there's a tremendous amount of environmental contaminants that were directly causing people to have higher rates of, hysterectomies or ovarian cancers, right? Because of where they were located, right? And certainly for the indigenous tribe that I worked with, they were disproportionately impacted, and there was a lot of like landfills and things that were being put in their communities that weren't being put in other communities. So kind of touching on this a little bit. So an example of this in Louisiana is something called Cancer Alley, which, so I'm from Louisiana, so it's near and dear to my heart, but I think it's a really good example because it really kind of shows, again, this kind of spatial map of, so this is the river, this Mississippi River. And you can kind of see, right, all where these plants are located, right? So these are oil refining plants, right? So we have a tremendous amount of oil refining in the South in general, but particularly in Louisiana. And then you can look at the population below the poverty line, and you can kind of see how if there's places where there's more poverty, this is also where there tended to be more plants and kind of hazards located, right? And so it's an 85-mile stretch. It has more than 150 plants, right? And it really specifically targeted African-American families and neighborhoods, right? And specifically put those plants in those neighborhoods and framed it as a way to give people jobs, right? And people needed jobs, right? But also was very strategic because they also knew that there would be less oversight in those communities, right? And they were able to skirt some of the environmental regulations. There weren't that many at the time, but there were still some, right? And so now they're still there, right? And they're continuing to build plants where now we have a lot more knowledge about the harm that it's causing, right? And it's still kind of an ongoing issue, right? And so sometimes the rates of emissions are 100 times higher than is recommended by the EPA. And it's kind of been associated with like a really large range of health issues. I also like to highlight this example because it also shows community activism and a really great example of reproductive justice. Some of the ways the community has been able to get these plants to shut down is by something that's been done by the work called the Bucket Brigade. And so they literally have just basically given people buckets. And again, they're kind of they're scientific, but they're basically just buckets, right? Where people collect air samples, right? Because the plants themselves were like, we're not being forced to monitor this and we're not going to, right? So the communities themselves did it and they got hundreds and hundreds. I mean, they collected so much of their own data. This was, again, totally community driven, and then took it to the EPA and to state authorities, right? And said, this is kind of, you can't dispute this, right? That this is harmful, right? So it did lead to the successful shutting down of some plants, but there's still unfortunately some there too. In Montana, I think it's really important to think of wildfire smoke as an environmental reproductive justice issue. So, and I think sometimes people are a little surprised about that, right? But it really is, right? So this article here, right, shows how pregnant people, so this is a picture of California, but definitely there's research being done on this here too, right? That if you're pregnant and there's a lot of wildfire smoke, right, you are much more likely to develop eclampsia and have preterm birth, right? So this has a lot of impacts on people when they're pregnant. There's not as much research, but also that cumulative smoke exposure might have impacts on fertility, right? So again, that right to have children. And then obviously like how it impacts young babies, right? Like my son is always heartbroken when he can't go outside, right, and play and exercise when it's smoky, right? So again, all the ways that smoke has these kind of multiplying effects, right, on undermining people's reproductive justice. I'd love to, since you all are kind of different parts of the state, other examples of reproductive justice issues that you see in Montana.
Just even access to primary care, access to care at all.
Yeah, well, and I guess, sorry, I maybe, and so that's definitely true for reproductive justice. So I'm thinking, sorry, I should have more specific. So environmental reproductive justice, are there examples of people think of that issues here?
I would say like agricultural, like runoff and water, in terms of people having access to good water.
Yeah.
And I would add food deserts to that. A lot of communities are food deserts.
Yeah, I really appreciate you mentioned that. Yeah, and that is very much related to environmental justice issues, right? As far as who has access to irrigation, what's happening with climate change, right? And who's going to be most impacted, right, by those issues.
I was thinking all the
Yeah.
mining that happens in Montana, like what is it, Bannock and Butte, and all the runoff, the toxic runoffs from that.
Yeah. Yeah, I like that you mentioned that. One thing that surprises me here, so in Louisiana, my son was tested constantly for lead, right? And here I found out that there's no like state mandate for lead testing. So again, individual providers can do it. And if there's, if there's specific indications it needs to be done, it will often be done, but it's not like expected, right? And so I was shocked when I came here, especially knowing that like in certain places, right, you actually are very high risk of having lead contaminants, right? And yet that hasn't really been a force behind doing the lead testing for children, right? Other examples?
I know there's a lot of radon in Montana.
Yeah. Any other thoughts?
I guess just the unknown like water quality for like a lot of people, since like they have their own like well drilled, and it's kind of expensive to like test your own water for like different, like especially like nitrates and things like that.
Excellent point. Yes, definitely. I think that that's really important and under kind of under conceptualized. All right, well, I'm going to have you continue kind of thinking this way. So now we're kind of going back to reproductive justice in general, right? But kind of think of how here in Montana, you see how these areas might be related to reproductive justice, right? So we kind of already talked about the environment, but let's choose maybe, let's choose criminal justice, right? So how might the criminal justice system in Montana relate to reproductive justice issues?
Well, one way is just having incarcerated parents, like, will impact their ability to parent their children.
Yeah. And you're making me think about too, there is some work being done about justice in jails when you're pregnant, right? So not only do we have incarcerated parents who already have their children, right? But then also kind of what happens when you're pregnant in the prison system. And there are lots of stories of people being like handcuffed to the bed when they're giving birth, right? Where you're not going to be running away. You're in a facility that's locked down anyway, right? And so that is a really clear example of reproductive justice violation. Any other examples for that one? What about employment?
Getting maternity or even paternity leave.
Right, we don't have any paid leave, and again, it's depending on your the type of job and how long you've worked there, right? You might not even be able to access the family medical leave, right? What about housing? This is one that oftentimes people kind of puzzle a bit, like trying to think about how housing connects to reproductive justice.
I mean, that just seems like so foundational for being able to like have a supportive environment of any kind, whether it's supportive to a relationship, to even consider having children, if that's something you want, or raising raising families, or if you live in a multifamily household, or if your neighborhood, has safe and adequate facilities for you to be in. There's a whole can of worms.
Yeah, and I like that you mentioned kind of what the neighborhood has too, right? So some of the work that I'm starting to do, I haven't really gotten to the data, is looking at like where parks are located and like kind of public access space, right? And how again that those tend to be in places where people already have more space anyway and more privilege, right? And kind of what that looks like. So I like that you mentioned that. I know they're getting close to the end, so we'll just do one or two more. Does someone else have anything on
Yeah,
housing?
Brittany, I'm sorry. I was just thinking housing's kind of, I would almost put it almost towards the top because housing is tied to everything. If you don't have adequate housing, you don't have an address, you can't get employment. If you don't have employment, you're probably not going to have insurance. And if you don't have insurance, how are you going to get the prenatal care you need or the postnatal care that you need? Like housing is so tied to everything. It affects education, it affects your food. I mean, it is, it affects all of this. So, and I mean, housing in Montana is
Mhm.
kind of a hot mess right now.
Yeah.
So yeah, that's a big one. Like that's huge.
Yeah. And, you know, housing is kind of indirectly related to like voting access too, right? Because again, you get your ballots mailed to you, and even though you can get them mailed to other places, right? That's kind of an added barrier, especially if you're transient. So yeah. Let's just do one more. How about immigration? Kind of how might immigration issues impact reproductive justice?
One thing, I grew up in a rural farming community, and there are a lot of migrant workers. And so just having stable medical access for those workers would be a big one.
Great example. Yeah. All right. Wow.
Or even fear of like going into getting that access because of like their migration status.
Definitely. And that is something, so even though people shouldn't be turned away, right? There, that fear is really present, and we know impacts people accessing prenatal care, right? So they'll go in just when they're in labor, right? All right, well, this was just a very brief kind of intro into reproductive justice. I researched this and could talk about it literally for weeks and weeks and weeks. So I'm really passionate about it. I'm really glad you gave me the opportunity to kind of share. I think that you should all have access to my email. So please do reach out. And again, I'll stick around for a bit and answer questions, talk about any of the projects. I can talk more about the mapping one that I didn't get to, or more of the doula work, or anyway, I do a lot of different types of projects. So yeah, any kind of final questions for me or anything? Thanks, Mandy, for putting that in the chat.
No, thank you.
I'm just going to make one quick announcement that if you were on, I will add your hours to the Canvas platform for you. So you don't have to worry about logging those hours. I will handle that for you. So any additional questions for Dr. Lydell?
And I see that that Holly put in about Pam. So yes, I do a lot of work with Pam. So yes, she's great and does a lot of work with our peer support recovery doula. So yes, yeah, she's lovely. And then I saw someone else posted about being taught that hospital births are the only option. Yeah, and that actually is in some ways like a little controversial in some ways, because it's also acknowledging that some people how to word this, that sometimes people feel safer in a hospital if they feel like they maybe don't have more resources in other ways. So actually that sometimes people who have marginalized access to care actually prefer hospital birth, which is kind of counterintuitive, right? So it's how do we make then that birth empowering and not traumatic, right? Even though it can be for so many people. And just to throw it out there, the book Pushed is really fascinating. It's about kind of the medicalization of childbirth. And so people who are interested in that might be interested in reading that. Also, I have a lot of books on reproductive justice. So again, reach out to me and I'm happy to share kind of a reading list of books. So yeah.
Thanks, everyone. Appreciate it. And thank you so much, Dr. Lydell. We really appreciated all of your insights and your knowledge. So thank you so much. And we'll just hang tight for a few minutes in case anyone else has anything. Otherwise, everyone is free to go.
Thank you.
Any burning questions?
You're getting a lot of thank yous, and you're just the coolest. So that's good.
I'm also wondering if anyone hears my son in the background. He just got home from daycare, so he's running around, but
I didn't hear anything. Is anybody left on have any questions?
Yeah, I wanted to talk about because I was the one who made the comment about substance use disorder
Okay.
and
Yep.
prenatal care.
Yeah.
And I wanted to, I don't know, I'm really interested in that. I'm a nursing student. I'm graduating in December, but I'm applying to the DNP program.
Yeah.
And my dream would be to be both a psych provider and a midwife, so I could do both the psych care and be able to be part of the birthing process.
Yeah.
But I'm really interested in what you're doing.
Yeah. Yeah, definitely. If you email me after, I can direct you basically to Pam, who is kind of currently doing most of the like recruitment for our peer recovery doula training that we're doing. So that's really mostly trying to train as doulas people who are already certified as peer support specialists, but not exclusively. And then we are hopefully, if I end up getting any of the grant funding that I'm applying for, going to be kind of broadening have offering trainings for people to get trained as doulas who are serving rural areas and kind of in that PMAT intervention, right? So that's not yet off the ground, right? But we're kind of working on that. So you're definitely willing to like, I'm happy to have you just reach out periodically and see how that's going. But if you're interested specifically in that recovery doula, like those trainings are happening now. I'm doing that. I'm already certified as a doula, but I'm just getting all the doula trainings because I feel like it's helpful. So I'm in that training program now and it's really great. And it's put on by Tree of Life Doula Care. So you could actually also just reach out directly to them too and see when they might be doing another training. But yeah, they're really great and very much have their own kind of lived experience and are using it to kind of inform the training. So yeah, but I would love to like, yeah, midwives, doula, nurses, doulas, like we all kind of need to work on this issue together, and it really shouldn't just be you know, I certainly don't think doulas can do everything, right? But I think that if we can incorporate what makes doula care helpful into other professions, that will certainly help things too.
Well, thank you.
Yeah. All right.
Shelby or Madison, did you guys have anything? They probably just stepped away. Well, thank you so much. I really
No,
appreciate
thank you
it.
again. This
Oh,
was
yeah.
great. Sorry.
Okay.
Oh, you're okay. No, you're totally
I'm
fine. I
chasing
just wasn't
littles
sure
as
if you had a
well.
question.
No, I was just chasing littles.
That'll happen.
Thanks,
Yeah,
guys.
have a good
Yeah.
night.
All right. Have a good night, everyone.
Yeah, thank you.